Thank you very much, Moto. I'll now like to invite Philippe Jaillard from AMP, who will speak to us about the feasibility of establishing a center of excellence, a regional center of excellence.
Thank you. Good afternoon. Je vais parler en français.
I will speak in French. In order to change a little bit the audio mood and also to add a touch of exoticism to this session, and also to help the interpreters and to relieve them. Thank you. So I would present you the work that has been done with the East African community for the creation of a center of excellence in health supply chain management and for medical supplies. The East African community has 5 countries: Burundi, Rwanda, Tanzania, and Uganda. The center was willed from the East African community because they realized that there was a weakness in the health supply system because there were weaker capacities in the personnel implied in this supply chain. Thanks to the Logivac system in Central Africa, the East African community, with the AMP support and Melinda and Bill Gates Foundation and Gavi, made an analysis for human resources for health supply chain, and also a review of the opportunities for training in this region. The method that was used has been adapted from the method developed for the USA Deliver project and the competency compendium that was developed by People That Deliver initiative. And the results of this assessment were discussed in a regional workshop, regrouping the five countries from the East African community, the EAC. And this allowed us to propose some recommendations for the next steps. This is a presentation quite holistic of the used method, and this helped us identify the gap between the competencies that was required or expected and the competencies and skills that were trained in the pre-service training for the staff that were working in health supply chain management. These are the results of this assessment. First of all, the organization of the SCM in different countries. We're talking about supply chains in plural, because in each country we have several supply chains, maybe not for each medical supply, but we realized that in each country, and this is for all developing countries, for vaccination programs, the supply chain has a parallel system. And we also saw a centralization of supply chain for departments and centralization for medical supplies. And some supply chains were managed by the health authorities. And we also saw that centralized procurement agencies for essential drugs also interfered in the management of some products in some programs for public health. So these supply chains varied from one country to another. They could be on a central level or very limited in a geographical area. So these health supplies could be distributed quite differently from country to country. We also identified the maintenance system for equipment and biomedical equipments, because each country had workshops and central workshops for infrastructures, equipments, and maintenance of these equipments, and management of biomedical equipments. But generally, we saw that these countries did not have decentralization and different departments dealing with these things on a district level, even though we had some technicians on a district and hospital level. The results and the findings of the supply chains for each country. So human resources in supply chains for health products. On a central level, in most countries, pharmacists are the main person who deal with the supply chains. And on a regional and district level, these are also pharmacists and technicians. And sometimes on a clinic level, in some countries and even in district level, you can see that technicians are very present, especially in Burundi, because they have very few pharmacists. In Rwanda, pharmacist is a job. It is a regulated job in the legal framework, but you cannot find technicians and assistants in the healthcare system in Rwanda. We also identify the role for the nurses and midwives for each level at the health supply chain, especially as a support for pharmacists and for the services level as well. We could see they were very committed and completely in charge of managing these health supplies. For vaccinations, we can see that very few pharmacists were involved in the process, but these are more technicians and healthcare workers, nurses, midwives that are present for each level of the supply chain for vaccination in each of the 5 countries. Training. We were very interested in the different components for training in supply chain and in learnings in pre-service training for the people we identified as working in the supply chain. Pharmacists, in most cases, receive some learnings in supply chain, but this is very limited. Sometimes a couple of modules, a maximum 50 hours along the whole of their training. And for nurses and midwives, learnings on the supply chain are even more limited. And generally, for pre-service training, we can see very little training on how to manage vaccine and cold chains, etc. On the other hand, we can see that these personnels for vaccinations have had some small training, and there are quite a lot of these trainings in these countries. Still on training, pharmacist school are present in 4 out of 5 countries. Burundi doesn't have any. And we can see that these schools are integrating more and more modules about supply chains with the help of partners. And we also identified the intervention of different organizations and government organization and private sector partners who help managing the supply chain, but generally these are small trainings that they give. And finally, we identified a low availability of training experts in supply chain management. And that was it. So, as far as lessons learned are concerned for this assessment, we could see that there were very few personnel involved in the health supply chain in these 5 countries. In numbers, and also in terms of quality and competencies in the supply chain. So these people are insufficiently trained, and we also identify that there were too few capacities from the institutions, be they national or training institutes from the public sector and the private sector as well. So there was a lack of vocational training for pre-service, even though you can see some very small trainings that happen quite often, but on an ad hoc basis. So there is no global training program. And finally, we also saw that there were too few trainers who could strengthen the capacities for the staff. So in order to tackle these challenges, these human resources challenges, we can see that strengthening curriculum and capacity building initiatives are required, and also there should be regional and national initiatives to enable environment for SEM. Next steps. The findings of this assessment have been presented and discussed in a regional workshop organized by the East African community. And the representatives of the 5 countries could make some recommendations about the missions and activities that the Center of Excellence for Health Supply Chain could cover and could implement. Amongst the missions, some of them have to do with training and capacity building. And it would be offering a training program which would be complementary, pre-service and in-service training. And they would be both e-learning and on-site training, so these could reach as many people as possible in the region. It would also contribute to recognizing SCM as a profession and also improve the environment for these professionals within their healthcare system. A list of activities have also been identified, and they should be realized by and implemented by the Center of Excellence, namely identify the training needs, adapting curricula to the needs, also implementing and disseminating these trainings. So this center should not be one training center, but it should help the training institutions on a country level, and it would be also a mean to use the national organizations, also the private sector organization who could contribute to train the staff. The other role of the center would be to act as a coordinator for the different training activities and to give quality assurance of these trainings that would be offered by the different training institutes. For developing good practices of health logisticians in the region, one activity would be sharing the good practices between these professionals and also facilitate the introduction and implementation of tools, techniques that would be innovative in the different countries. And finally, this center should also develop some research activity and operational research activities and offer technical assistance to the different countries in the region. These were shortly the results of this assessment. and of this meeting that took place in Nairobi in June, and it helped us define the big orientations for the next steps, and some activities should be short-term ones. I've made a list of some of them in order to highlight the process and to start a discussion and to show the necessity of starting a strategy for training. And this will depend on the development plan for each country and of the region that should be developed. And we saw that there was a lot of different people involved in the logistics, in the supply chain. Some of them work full-time with it, and some of them work, just give a little bit of time to this. And we will need some complementary activities and use of the existing activities as well. I am finished with my presentation. I hope that during the next conference, organized by People That Deliver, somebody will be able to present a Center of Excellence, which will be up and running, and hopefully many of the partners who are in the region will participate to this project. Thank you very much.
Thank you, Philippe. We also hope the same.